I bet you didn't think that diabetes could actually give you hearing loss, did you? Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm talking about the surprising link between diabetes and hearing loss. At this point, you're probably up to speed about the research between untreated hearing loss and an increased risk of cognitive decline and dementia. But you may not be up to speed about the link between hearing loss and diabetes. It may not surprise you that there's a lot of people in the United States with diabetes who also have hearing loss. After all, according to the CDC, there are approximately 38 million Americans with hearing loss and 38.4 million Americans with diabetes, with another estimated 98 million Americans who are pre-diabetic. However, the prevalence of hearing loss in individuals who have diabetes is significantly higher than individuals who do not have diabetes. Now, my father is a diabetic, and he was a farmer exposed to noise his entire life. So if anyone with diabetes would have hearing loss, it would be my father, right? Nope, turns out my father actually has better hearing than I do. It turns out that my mother, who is not diabetic and spent her entire life in a quiet office as an accountant, has been my patient since 2021. I think this clearly illustrates that just because you have diabetes does not mean that you're also going to have hearing loss. But in this video, I want to explore this link between diabetes and hearing loss to see if it's just a coincidence or to see if diabetes is actually fueling this epidemic of hearing loss across the entire world. But before I do me a huge favor, click that like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. And let me know down in the comment section if you or someone you know has diabetes and if you feel like your hearing loss has been affected by it. In a recent systematic review and meta-analysis published in the Otolaryngology Head and Neck Surgery peer-reviewed Oto journal, researchers identified that individuals with type 2 diabetes had a prevalence of hearing loss that ranged between 40.6 to 71.9%. Compared to the control group of non-diabetic individuals, the risk of hearing loss was 4.19 times higher in the diabetic group and predominantly affected the high-frequency ranges of hearing. They also identified that the duration that someone had diabetes and the levels of hemoglobin A1C were significant factors in the prevalence of hearing loss. Let's take a step back and talk about diabetes here for a minute. Generally speaking, there are two different types of diabetes: type 1 diabetes and type 2 diabetes. Type 1 diabetes is considered an autoimmune condition where the immune system attacks the beta cells inside of the pancreas and basically prevents the pancreas from creating insulin, which doesn't allow the body to regulate blood sugar levels. This is typically caused by genetic factors and or environmental factors, not lifestyle factors. Type 2 diabetes is considered a metabolic condition where first the body develops resistance to this insulin production and then eventually the production in the pancreas stops. This type of diabetes is typically associated with lifestyle factors such as being overweight or eating a lot of sugary foods, but other variables can play into it as well. The diagnosis of diabetes has a lot to do with your hemoglobin A1C levels. Hemoglobin A1C is a measure of how much glucose or sugar is attached to the hemoglobin inside of your red blood cells. It actually measures your average blood sugar levels over the course of the past 2 to 3 months instead of just your blood sugar levels right now. If your hemoglobin A1C levels are below 5.7%, this indicates normal blood sugar. If you're between 5.7 and 6.4%, you're considered to be pre-diabetic. And if you're at 6.5% or higher, then you're considered to be diabetic. Aside from A1C levels, the prevalence of hearing loss in individuals with type 2 diabetes is 4 times higher, whereas it's only 1.8 times higher in individuals with type 1 diabetes. This is likely due to an increase in other metabolic disorders for individuals with type 2 diabetes, such as hypertension, dyslipidemia, and obesity, which have also been linked to hearing loss. But why would elevated blood sugar levels have a negative impact on your hearing? Well, there's several reasons. One is that excessive blood sugar can thicken blood vessel walls. This can lead to reduced and impaired blood flow to the capillaries inside of the inner ear. If you deprive these capillaries of blood, it reduces the flow of oxygen and other nutrients that would be carried in the blood, ultimately causing permanent damage to the stria vascularis as well as the other structures inside of the cochlea, including the inner and outer hair cells. This metabolic stress can also lead to increased inflammation inside of the inner ear, which can cause even more damage to these delicate structures. You also have to consider the change in osmolarity of the fluid that's inside of the cochlea as a result of higher blood sugar. This can actually lead to a higher level of pressure inside of the cochlea, which also leads to vestibular symptoms. There's also the possibility that individuals with diabetes could be at a higher risk of noise-induced hearing loss if their cochlea is in a constant state of higher oxidative stress. And the type of hearing loss that individuals with diabetes are typically associated with is a high-frequency sensorineural hearing loss. This is what that type of hearing loss looks like on an audiogram. When you're looking at an audiogram, the blue X's represent the left ear and the red circles represent the right ear. The further down you go on this graph, the worse your hearing is. And it's like a piano keyboard, with the lower pitches on the left-hand side of the graph working their way through the mid pitches and into the high pitches on the right-hand side of the graph. It's important to note that with this type of hearing loss, it reduces the clarity of human speech, not the volume of human speech, because clarity is a result of the high-frequency speech components, which are no longer audible. Not to mention, in addition to the lack of speech clarity, this particular type of hearing loss causes auditory deprivation, where sound can no longer make it from the ears up to your brain, which can also trigger something called tinnitus, which is a phantom ringing and buzzing sound in your head. Unfortunately, when it comes to hearing loss and tinnitus, they never go away, which is why getting your blood sugars under control if you have diabetes is so important. And like I mentioned earlier in the research study, not only is the level of blood sugar a problem when it comes to diabetes and hearing loss, but it's also the duration and time that someone has had diabetes. Data suggests that individuals who've had diabetes for 10 or more years have a higher prevalence of hearing loss as well. Diabetes also seems to have a negative impact on younger individuals below the age of 40 that would not normally be experiencing high-frequency hearing losses due to age yet. And while we can't necessarily say that diabetes causes hearing loss, it sure appears that the same factors that cause diabetes also have a negative impact on your hearing. So now that we have a better understanding of this link between diabetes and hearing loss, what exactly can we do about it? Well, I have a few ideas. First, if you have hearing loss and you haven't seen your primary care physician in a while to get your blood sugar levels checked, it might be a good idea to do so just to make sure that your A1C levels are not excessively high, which could be having a negative impact on your hearing. Second, if you are diabetic and your A1C levels are elevated, you need to do something to get those levels back down. A lot can be done by controlling what you eat and exercising regularly. There's also some evidence that those new GLP-1 drugs may actually help to lower your A1C. Of course, make sure that you consult with your physician before you do any of these things. Third, if you've been diagnosed with diabetes or your A1C levels are above 5.7%, I would highly recommend that you schedule an evaluation with an audiologist just to make sure that your high-frequency hearing is okay. And fourth, if you've been diagnosed with a hearing loss, you need to treat that hearing loss as fast as you possibly can. The longer you wait to treat your hearing loss, the more difficult it becomes and the less benefit that you stand to receive from whatever treatment's right for you. The most common treatment for this type of hearing loss is hearing aids. But you have to make sure that those hearing aids have been fit and programmed by a hearing care professional who follows comprehensive audiologic best practices. And the best way to find one of these rare hearing care professionals is to go to my website, hearingup.com, and find a Hearing Up Network member in your area. All Hearing Up members have been vetted and are committed to following comprehensive audiologic best practices when diagnosing and treating your hearing loss that may be tied to your diabetes. So if you want to make sure that your hearing is tested correctly and that you receive the best treatment possible with hearing aids, then finding a Hearing Up Network member in your area is your best bet. At the end of the day, the prevalence between diabetes and hearing loss is too big to ignore. But I want to know what you think. Do you think that this link between diabetes and hearing loss is purely a coincidence, or do you think that diabetes can actually cause hearing loss? Let me know down in the comment section, and I'll see you in the next video.